back to Cancer with Dr. Denise, the CEO of Common Cancer Foundation, on the Cancer Awareness Program in partnership with Plus TV Africa. Together we fight, together we win. We thank you all for championing our cause to get our voices heard this 2025. And so today what we're going to be doing, we're going to be talking to the President and the CEO of the Nigerian Cancer Society, Professor Abidemi Omonisi, on the turn of a new era, Prof's vision for the future. Good evening, Prof.
Good evening. Thanks for the invitation. I'm happy to be here.
Thank you. So let's look at what's going on. So firstly, let's start by saying Happy Ramadan. Ramadan Mubarak 2025 to all our Muslim brothers and sisters. May the divine blessings of Allah bring you hope, faith, and joy during this Ramadan and always. That's how we're going to start. And this month is Colorectal Cancer Month. So before we start our actual program, let us look at what's going on in the cancer space. Colorectal cancer is the third most commonly occurring cancer type, and the second most common cause for cancer deaths globally. And so over the next 4 weeks or 5 weeks, a lot of programs will be aired talking about colorectal cancer and colon cancer. So watch the space as you stay with us. Together we fight, together we win. This is a new day, this is a new dawn. Prof, everyone sit back, relax, and let's start this conversation. Share, follow, and subscribe to the Common Cancer Foundation on all our pages. And those of you watching online, welcome. So let me tell you who our guest speaker is. To many of you may know him, to many you don't know him. Professor Abidemi Emmanuel Omonisi is a meticulous physician and renowned scholar of over 20 years experience. His research interest is oncology, and he has numerous prestigious scholarships, fellowships, and grants from universities of Florida, USA, Oxford University, UK, University of Yale, USA, and the Bill Gates and Melinda Gates Foundation, Mayo Clinic, US, among several others. He has published over 80 articles in both local and international journals. I want to say a very big thank you for joining me today, Prof, so we can actually delve into what's going on in the cancer space as you have taken over for 2025.
Thank you very much.
You're ready for me now. So thank you all for joining us. Let's remain united against cancer. Together we fight, together we win. Our first question for you, Prof, is you've spoken about being a transformative, about this time being a transformative period. And what defines this new era of your vision, and why is it so significant?
Yeah, thank you very much once again for inviting me. I took over 1st of November 2024, and I'm just a few months in office, but I was the vice president or the immediate past president, Dr. Umar. So my government initially is a government of continuity and consolidation. In the Cancer Society, surprised to know that it's the oldest and the foremost cancer society in Africa. Matter of fact, our founding fathers, actually gave back to Iotic. But over the years, for a period of almost 15 years, there was leadership gap in the country, in the Nigerian Cancer Society, so that actually affected our society. So it made us appear as if we are, just starting an event, but we are not just starting. It's a very old organization. However, coming on board, there are quite a number of challenges we've experienced in the past, and I'm a part of the National Executive Council for almost 6 years. I've used that period to crystallize those, challenges. And of course, passion is oncology. I'm an expert in cancer epidemiology and also molecular pathology. So over the years, involved in several, training, products, research, intervention, then quite a number of conferences. We've also seen how Cancer Society are running other clients, both within Africa and outside Africa. So put together those experiences in a way, about restructuring a cancer society, to actually take over. I mentioned we're the foremost, we're the leading, many years ago, but because of that break in our administration and also, continuity, it does appear in young society, it's just starting, and trying to catch up with other African countries. So what we are trying to do now is to force restructure our society. You agree with me that the society that was founded in 1968, we cannot use the same approach in running society now generating our time in 2025. So we are trying to do rebranding of our society, trying to ensure that there's organizational restructuring, to ensure that what happened during the dark moment, I'll call it that dark moment, 10 to 15 years where there were no vibrant activity as well in cancer society does not actually take place. And most importantly, one fact that I've noticed over the years is that the survivors themselves, are not, adequately, incorporated into the running of society, and that always my position that there is no way we talk about Nigerian cancer society and we do not recognize the place of the cancer survivor. There are major stakeholders, we should think that, they should be actively involved, decision making at all levels. They've survived cancer, they have the personal experience, they can share their own story, far, far better than we scientists, trying to share their story with them. So, I came out with my strategic agenda, and the key on my strategic agenda, is to accord the cancer survivor the rightful place in the running of society, starting from the board of trustees. We are trying to also restructure the board of trustees. We have 6 before, and you know that Nigeria is a country that we have many regions, 6 to be more precise. We also have over 250 tribes. So in constituting the board of trustees, we must have equal representation for at least all the socio-political zones. But most importantly, I'm trying to also ensure that we have at least 2 survivors on the board. So apart from the board of trustees, just in January, I established and inaugurated the state chapters, and I'm glad to report that some of the interim chairs and also interim secretary of our state chapters, are also cancer survivor. So committee also were also consulted, recently, and we also appointed the cancer survivor as the chair of those committees. So we must, drive this agenda of all inclusiveness. Particularly cancer survivor must be part of it. They must have a voice, in running our society. In the past, this have not been so, but we have said that that is one major changes I'm going to effect on my administration, so that they are partner in progress, and then talking about the structure, they can be part of it. And for the first time in the history of our society, we also have one cancer survivor as part of the National Executive Council. So there's nothing we are hiding. It's a transparent organization. So at all levels, going to involve cancer survivor in the running of the society.
Thank you. That's a very good start, because it just shows that you are actually you've got your foot running. Your roots are on the ground now. You're just running as you just came on board. And yes, that's correct. A lot of things have changed, or a lot of things are changing. For us as survivors, we would like to say thank you, because we are actually noticing it. As you know, we don't hesitate to let you know we're actually a very happy bunch at present. So I'm going to ask you a second question now, because you're all about this transformation. We have to recognize that it comes with challenges. So what would be your greatest obstacle in realizing what you want to achieve, and then the purpose for overcoming them? What the process what do you think, or what strategies do you think you would like to use?
Yeah, I think my major challenge now is the issue of cost of treatment for cancer in the country. The cost is very enormous. To treat a patient that has breast cancer, from diagnosis to stabilization, that patient will need between 16 million and 20 million. How many patients can afford that? As a matter of fact, those cancer survivors that have stabilized, that are on medication, on a monthly basis, they spend average of 1.5 million. So how many Nigerian patients can afford that? Even people already placed in civil service, how many of them can afford that? So the major challenge, currently is that many of our cancer patients actually have stopped their medication, but they cannot afford, that huge price. And as somebody in the cancer space, major challenge to me, because once the patient start the medication and not stop, you are cultivating serious resistance. So it's a major issue. And what we are putting in place, we started advocacy, engaging forums of health, and also National Institute for Cancer Research and Treatment in CRAT. There's currently SADU responsibility of running the National Cancer Aid Fund to address some of those challenges of cost. Particularly, we must also destroy every government bureaucracy. We know that many of those drugs are not manufactured in the country. In fact, none. The major active chemotherapy drugs are not manufactured in the country. Those drugs are important to the country, and with the fluctuation of dollar is also a major issue. But at this point, I must commend the Federal Ministry of Health. We know that the Federal Ministry of Health set up a program, that we call NCAP, that promote easy access to those chemotherapy drugs. Matter of fact, many years ago, it was extremely very difficult getting those drugs in the country. Many of our patients have to import those drugs from UK, from abroad. They send via fast APS to the country. But since Federal Ministry of Health set up the NCAP program, that really helped to address that challenge. But that program also has some challenges now because of issue of forex. Many of those pharmaceutical companies that are part of it, they have challenges in those drugs in the country. So it's a major issue because as a country, my press release some few weeks ago, I mentioned that the federal government must start looking inwards. We have giant pharmaceutical company that have the capacity, if supported, to produce drug, in our country. Quite a number of them are venturing into other drugs, other medication, antibiotics, analgesics, etc. We know that chemotherapy will cost more, but the federal government can support. Where there are adequate support from federal government, I'm sure that those companies can take up the challenge to produce those drugs, in our country. That is a very important issue that we need to address. Because as I speak now, quite a number of our patients, and our members, unable to afford medication. The other one, cancer, day last month, I was at National Hospital in Jabi and have interaction with the cancer patients in our nation, and their relative. Some of them are passing through hell, to sustain the cost of treatment. So it's a major issue, and I hope that federal government will address those issues. And what we are doing as society is to actually float our own independent cancer intervention fund, because I've mentioned to you, those drugs are extremely very expensive. Federal government has done their own part, and this is the National Cancer Aid Fund, where patients supported by 1 million naira. Of course, there are also several issues with that. Issue of access, accountability, bureaucracy is also there. But as society, we cannot just continue to lament, and see our members continue to suffer. So what we have done, let us approve that we set up our intervention, what that we call SCS and Cancer Society Cancer Intervention, fund, and our target is to actually reach 10 billion naira, to support our cancer patients. And this is extremely important because we know that the federal government currently supports just for cancer, that is prostate cancer, cervical cancer, and breast, and also childhood cancer. But I'm happy this colorectal cancer month. Colorectal, for example, is a major cancer that is actually killing Nigeria. As we speak now, is the second most common cancer in males in Nigeria, and also the third most common cancer in females in Nigeria. And surprisingly, very sad that that cancer is not covered by the federal government under the National Cancer Aid Fund. And we have a number of our patients, our members, currently having that that disease. So it's an issue that we need to look at it passionately. I've appealed to the Federal Ministry of Health to do something about that, so that colorectal cancer and hematological cancer should also be included the National Cancer Aid Fund. However, we are not just sitting by the side. Our plan is to raise 10 billion naira to support those cancer and other cancer, because anytime you talk about cancer, people just think it's breast, cervical, and prostate that we have. No, there's other cancers, that we have in the country, and they are members of our society. It's our responsibility, to find a way to support them. So that time, we're trying to set up a national committee, shared by very important and also an expert in financing, Dr. Gafar, Lawale. And we also have people from different educational background, as member of that committee. We have lawyers, we have community representatives. Of course, we also have a cancer survivor there. Their work is to help mobilize funds from private sectors, for companies, pharmaceutical companies, philanthropies, that will be managed by these experts, people that have been governing board and set up to manage that fund. I want to use that as a case study, to promote transparency, accountability, so that people can know that we also have the capacity to do things in a very transparent manner. The one on my federal government, a lot of complaint by cancer survivor. Access, is a major issue. People have raised issue of transparency, over the years. Bureaucracy is there. We are trying to liberalize our own so that people that actually need that support, will get that support. But one thing about cancer is that timely intervention is very important. Timely intervention. The patient needs that intervention today, and you postpone it by a week or two. Maybe probably too late. 1 second count, maybe a game changer in management of cancer patient. If a patient, has a stage 2, for example, and you delay, and now man get to stage 3, stage 4, you are sending that patient to his early grave. So our own will promote transparency, will make it very robust, so that people can access, from all you see the political zone. So believe that cancer intervention fund can support patients, that will need, that support in getting their medication, also, doing follow up in the hospital. It also surprises you to know that some of our patients and some of our members cannot even afford transportation, cost of transportation to the hospital. So follow up is also a major issue now. To many of them, they cannot go for follow up. So without that pool, we can support them with that transportation money and also palliative care. So the last time we have at the national.
I want us to come back on this last part that you're talking about, but we need to take a break now. And you're going to finish this conversation by telling us how you're going to deal with all these issues that you said. You see, these are the social issues that we go through as cancer patients. And I never exempt myself from the challenges. So it's a we thing, and you are on that side. Me, I'm on this side now. I cannot do us because it can't work. But anyway, let's take a quick break and then we'll continue this conversation. Thank you very much. Viewers, we'll take a quick break and then we'll come back on. Welcome back. As I said, we'll have to continue this conversation. Thank you all for staying with us. Let's continue this and let's try and wrap up this particular one because we want to know what you're going to do with the next generation. So, Prof, can you now round off for us on that point that we stopped at, which was looking at what's your next steps?
Yeah, the palliative is very important. We must support, the cancer survivor. And again, we're also trying to, bring them together because I've said that we need that platform. I'm happy that the coalition is stronger now. Cancer Champion Coalition is a coalition where we now bring all the cancer survivors together under one umbrella. Because before now, people work in silos. I would think that cannot happen as a country. We now have a platform where cancer survivors, be it colorectal, breast cancer, whatever the cancer, once you're a cancer survivor, belong to that coalition. We organize, trainings, webinars, to encourage them, to talk to them on some of those. Because one thing about cancer, ignorance, is a very serious matter. It's quite some of the cancer patients, survivors in our country, they don't even know what they're having. and it's not their fault, because sometimes, the way kind of practice, medicine practice in our country, patients are not well educated on what, disease they have. Some people don't have that, complete information on that. And again, you can also not blame the healthcare giver, because, in Nigeria now, we're in a very terrible situation, because of this Japa syndrome. WHO have said that, the standard, ratio of radiation and clinical oncology to cancer patient is between one cancer, radiation oncology to 250 to 500 cancer patients. But in Nigeria now, it's almost, one radiation oncology, to 2,000 cancer patients. So if you visit many of the, clinic now, you find the queue, patient, be in the clinic in the morning, come to the clinic in the morning, and they'll be leaving very late because they have only one or two radiation oncology attending to, several patients. So that is the challenge. So there's no time to educate the patient. So what we have done now, through this coalition, we organize seminar, we organize webinars on issues that have to do with that. One area that is our priority now is to address their mental health. People will not know that cancer patients, they pass through a lot of emotional trauma, psychological issue. And nobody is talking about that. It's only medication, give them medication. The psychological issue also keep faster. Some of them once just say, cancer, the next thing, I'm going to die. Before it, fear will set in. They have psychological trauma. And then their blood pressure is not shooting up. They even die, from complication of blood pressure, than even the cancer itself, So some of those issues, we are trying to address, some of those social factors, that is why we need to bring them together. The issue of research also, what we have seen in the past, is what we call this helicopter science. People just come from the US, come from the UK because they have money, just come to the clinic, take the blood sample of our cancer patient and just disappear, and transport them to, to UK or to wherever. That will not allow that, so we are trying to educate our cancer patients. They must be fully, involved, fully, educated, whatever study, they want to do on them, and also be part of it. What stop a cancer researcher, for example, if they are slots, to employ, we can also employ cancer survivor. We have some of them, they are jobless, because of the long, hospitalization. Particularly those that work, in the private sector. They were retired from a place of work. So as we speak now, some of our cancer patients, some of them are jobless. They have nothing to do. So what we are trying to do is to also collaborate with cancer researcher. If in your grant you have opportunity to employ volunteers or to employ, some staff, also consider employing, cancer survivors. So that's, what we're trying to do. And it's now will bump up, some of them that are actually jobless, at the moment. So that cancer, coalition, I'm highly interested in that, and so I came on board and giving all the support to ensure that we have a very solid, the cancer survivor, because that will help us, And again, lastly, on that, the advantage of that is now also, serve as the platform for clinical oncology trials. One of the major issues we have is that we don't have indigenous company, producing these drugs. So one strategy to address lack of, or limited access to this drug is for us to also encourage indigenous, clinical oncology trials. Now I've said, Nigeria, we are brilliant people. We have people in the academia that are involved in several research. Instead of contributing research, to the Western country, let's do this in our country, and it's possible. So also the cancer patient, we can, partner with our, partners, in the Western country, and we do clinical oncology trial here in our soil in Nigeria. And doing that, that also gives us a platform, because the truth is that most of the, chemotherapy that we have in the market, the clinical oncology trial actually done, on the white. And that is why some of those drugs are not, very effective. When talk about efficacy, we don't derive maximum efficacy in the blacks. So what we're trying to do is to encourage, this clinical oncology trial, in the blacks. Nigeria, we know we are the giant of Africa. We are the most populous black country, in the world. So we should have to host, quite a number of clinical oncology trial when it comes to, oncology, drugs. So this coalition will serve as a pool, where, we can collaborate, with researcher, to encourage clinical oncology trial in our country.
Oh, thank you, Prof. You really have, I've now realized that we're going to have to bring you back on, because there's still a lot for us to talk about. But I think I'll bring you back on with the coalition. And to all those Nigerians who don't know what the coalition is the coalition of cancer champions. Cancer champions are all of us who have who have had or are going through cancer. We redeem ourselves as the champions, because for as long as we have it and we are fighting it and we're coming out of it, we are grateful to God. So I want to say, with that note, Prof, I'm going to have to end by saying a very, very big thank you to you. I will have to bring you back on, but we'll bring you with a champion. I think that's the best way. And to say that as champions, we really appreciate your drive for us. And in the Nigerian cancer space, I think everybody's very excited with all your innovations. And so to all Nigerians, look out for what's going on in the Nigerian Cancer Society. Go and look on the social media, go and check around, you will get the information. This month is colorectal cancer month. Trust me, the Nigerian Cancer Society has a lot going on. The champions themselves have a lot going on. So you shouldn't be left out with worrying of trying to find where to get help. There is help everywhere. And with that, I say, thank you, Prof, for joining us. It was very good to have you.
Thanks for the invitation.
And to all our viewers, together we fight, together we win. We will see you again next week. And next week, we will be having somebody to talk about colorectal cancer, their experience as a family member. Follow us on all our social media pages, Common Cancer Foundation, any of the social media. And this video will definitely be on our YouTube page for you to go and watch, like, and subscribe. We look forward to seeing you again next week. Thank you all, and thank you, Professor Omonisi, for joining me tonight.
Thank you.